All right, thank you everyone for joining in, and we are here at Premier Health Express Urgent Care located in Columbia, Howard County, Maryland. And we just want to go ahead and introduce Ms. Fowler here, and she is an intern at Warrior Centric Health Foundation, and here she is to go ahead and talk more about that.
So as an intern, I worked on an independent study or independent research project that focused on barriers to care for veterans. So the barriers that I focused on specifically were accessibility, stigma, and reintegration. And I looked at those in a military context. So those who are part of the military culture, which possesses its own values, mindsets, expectations, and in particular exposures. And those with military experience, especially in times of conflict, can be exposed to a lot of dangerous situations with lasting consequences. So it's important for a healthcare facility to understand those. So some major health concerns for veterans and service members. With the increasingly sophisticated body armor and life-saving medical practices, more military are able to return home to their families. So according to the National Center for Veterans Analysis and Statistics, 35.9% of all post 9/11 veterans have a service-connected disability, and that's in comparison to the 18.6% of all other veterans that are not part of the post 9/11 era. So that suggests that a lot more people will rely on the VA, and presently the VA is fairly overrun. They have a lot more people who need services more than what they can provide, so there are a lot of wait times. That does play into the accessibility issues that I found in my research. So due to their unique exposures and experiences for both combat and non-combat, service members require medical care that is sensitive to those differences. So it's important for people within even the civilian sector to have knowledge of those. And even though physical effects of war are easily seen, there are a lot more psychological effects of war that have an impact on service members, even more so than what we understand as a general population. So what we're working on here at Premier Health Express Urgent Care is building a veteran medical neighborhood consortium model. And I have a visual here of that. The urgent care is at the center, and we're partnering with different areas that help our patients beyond what we can provide. So we have American Diversity Group, which is one of our partners. They work with underserved populations, so they host a lot of health fairs like the one that we had today, and they get those people connected with providers that will be able to offer them services that they can afford. We also have the Warrior Centric Health Foundation, and they are our connection to the veteran and service member population. They work a lot with the community and connect them to services that they may need a lot with healthcare, but also in other areas, such as resources for daily living, which will also be part of the consortium model. So as far as model expansion, I would like to add empowerment and resiliency opportunities. And this could be part of relief missions, it could be interest groups, peer support, recuperation outings, community outreach, stuff like that. And we're hoping that veterans will, connect with each other, hopefully connect each other to these services. And we're just basically increasing well-being for our patients, beyond just a strict medical basis. We're looking at their life as a whole.
Definitely, yes.
And so we're hoping that if some degree of empowerment and resiliency is attained, that veterans will have a stable foundation for improvements in all areas of their life. So if they need, let's say, mental health therapy or something like that, if they have that strong foundation, that strong peer support, community support, they'll be more likely to reach out for that.
Yeah. Thank you, Ms. Fowler. And to everybody watching this, we appreciate you tuning in, but what's more important is that the veterans and the people in armed forces and their loved ones, we can't say enough all the sacrifices that they have provided for us, and yet, as you mentioned, when they go ahead and return and all the necessary services that they need to have, it's not available for them. And that's a challenge that we are trying to go ahead and meet here with Premier Health Express Urgent Care. And is it okay if I talk a little bit about, so you mentioned about wellness, in terms of health and wellness.
Yes.
And that's why we're able to go ahead and work with Dr. Nokori here, is that because when we had our health and wellness fair, we were talking about all of these things, and for us, we'll be able to go ahead and partner up wherein we will have physical therapy here as well, and then in our physical therapy clinic, Dr. Nokori and Premier Health Express Urgent Care will be our practice as well. And the other thing, so in terms of medical specialties, you see you have part here, and that's what it is. We are here as a team, and we need to all work together, as you mentioned, to provide that support to the veterans, to these war heroes, whether known or forgotten or what have you. We are here for you, and we will do our absolute best to go ahead and meet the needs that you have. So, is there anything else you want to add, Ms. Fowler?
I believe I've covered almost everything.
All right, sounds good. So again, thank you for tuning in. And if you see if you know a veteran and their families and so on and so forth, never stop to go ahead and say thanks for what they do, and all the things that they have gone through. We don't necessarily would understand if we'd never served, and that's why all the challenges that they have there, we just try to provide the necessary support. All right. Thank you. Good job with this study, and hopefully this will open doors for other people to go ahead and provide these necessary services. All right, great. Thanks, everyone.
Thank you.
All right.
Is that kind of what you were looking for?
I think so. You tell me.